My name's Dr Ben Mercer. I'm a consultant cardiologist specialising in the management of cardiac rhythm problems. I work at the Leeds General Infirmary, and I also have a clinic at the Spire Hospital in Roundhay, Leeds as well. So I always had a fascination with biology, the human body, the workings of the human body when I was a youngster. And that grew as I was at school, through university, and yeah, just the that allied with the sort of caring aspects of the profession, um, helping patients and getting reward from that is what attracted me to the profession, and that's been sort of well founded and validated as I've progressed through my career, and it's a very rewarding, enjoyable career that I'm currently in, and yeah, I'm very happy with the choice that I made. So I think the heart is an amazing thing. I had a few minor heart rhythm problems when I was a youngster, had some treatment myself, and that had quite a big impact on my life, allowed me to get back to sport, play football, and be basically normal again, not worried about taking medications. So I think, in all honesty, that's probably what attracted me to the field of cardiology. And then when I started work, found it very interesting, dynamic. You get to meet lots of people of all ages, from very young patients to elderly patients, and everyone in between. There's lots of things happening with research, lots of exciting procedures and treatments that we can do with patients to really have quite a profound impact. So that's what's attracted me to it, and is what has kept me in the field. And again, it's something that I enjoy enormously, and I do think the things that we can offer nowadays really do help patients in a big way, and it's really nice and rewarding and a pleasurable job to do when you see the impact and the outcome of those treatments that we can provide. What do I find? I find a lot of things rewarding about my job. The most rewarding is I like to perform procedures. I find it technically quite challenging, and I enjoy that aspect of it. When patients come to me and have any problem, guiding them through the journey, right through to hopefully being able to help them is ultimately the most rewarding thing. When I see a patient and we go through a treatment program, be that involving medications or procedures, performing that, going through that journey with them, and then being with them at the end of that journey when hopefully we're in a position where we've made a positive impact. That's ultimately the thing that I find most rewarding, building that relationship with the patient and yeah, having a positive impact on their well-being is what I enjoy the most. So I cherish and value the trust that patients put in to me, into us as doctors. It's a very honoured position that we're in, and I take that trust seriously. I think that patients value the honesty and the approach that I have with them, and that's sort of reflected in feedback that I get from patients I collect. That's our obligation nowadays, but it's something I also do to try and tailor the way I work. Being approachable and helping patients to understand their options rather than dictating what they should and should not do in terms of the management, I think is important. And I think being listened to and being involved with the decision making is something that patients really appreciate, and is something that I pride myself and certainly attempt to do in every step of the way of a patient's journey that I'm involved with. And I think that's the the thing that I would guess that patients would value the most about being under my care, or the interactions that they have with me.